Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about voice pathologies, that is spasmodic dysphonia. Spasmodic dysphonia means there is dysphonia because of the spasm of the laryngeal muscles. Simple. There is not involvement of local laryngeal pathology. Means there is not a local laryngeal pathology, but there is neurological pathology. Okay. For example, there is association with Parkinsonism or Alzheimer's. Okay. The other associated dystonias are oromandibular dystonia and blepharospasm dystonia. Okay. So what kinds of spasmodic dysphonia is seen? Okay. So first we have adductor laryngeal spasmodic dysphonia, adductor laryngeal spasmodic dysphonia. Then we have abductor spasmodic dysphonia. Then we have mixed spasmodic dysphonia. Simple. First only adductor laryngeal spasmodic dysphonia, then only abductor spasmodic dysphonia, and third we have mixed dysphonia. Let's see the adductor spasmodic dysphonia. Here the adductor, that is cricothyroid. Okay, adductor cricothyroid. Okay, so there is vibration at the midline due to adductor. Okay, if there is spasm in this midline, so the voice will be like strangulated. If someone is strangulating your neck, okay, the voice will be produced like that. Okay, so that is called strangulated voice or scratchy or croaky voice. Okay, because of the adductor spasmodic dysphonia. In abductor spasmodic dysphonia, the thing is that there is a spasm of posterior cricoarytenoid that was responsible for abduction of vocal cords. Now this cannot come back to the midline because of the spasm in abductor muscle. So there will be breathy voice, like throughout producing voice there will be spaces because these abductors are in spasm. So there will be breathy voice. Okay, but in adductor spasmodic dysphonia we are like someone is pressing. Okay, so this was adductor spasmodic dysphonia. Now we have to know the treatment. The treatment, botox. This releases the spasticity and makes it more mobile. Botulinum toxin. Okay, so we have to give the laryngeal injection, and this is given in the respective laryngeal muscle. On relief, we can think of the cause, that is what is the neurological condition behind this, because this is not the permanent solution. Okay, so we cannot give systemic medications to treat the neurological conditions, only local possibly things will try. Okay, so this is not a cure. Okay, injection may work for 6 to 10 months and then again it can recur. Okay, so this botulinum toxin, this is just a temporary measure. Okay, and later there will be intolerance. Okay, so what will happen that after 6 to 10 months the muscle will not work from botulinum toxin also. So we have to give the supportive therapy, that is speech therapy. Okay, so treatment is botulinum toxin, and since neurological conditions, if it is treated then it is fine, and if it is not then we have to go for supportive treatment, that is speech therapy. So this one is about the spasmodic dysphonia. Here only let's learn about one more pathology, that is phonoasthenia. Now we have learned about the spasmodic dysphonia. Now we have to learn about the phonoasthenia. So there was spasm. Now here this is asthenia, means weakness. Weakness because of aging or weakness because of some other pathology. So here we will find weakness of thyroarytenoid muscle, that to the medial fibers, okay, of vocalis muscle. So the weakness of thyroarytenoid and interarytenoid muscle, that is transverse arytenoid muscles. So what will happen? There will be bowing of vocal cord. Okay, and that bowing of posterior 1/3. Only the posterior 1/3 is bowing. Okay, so this will give a keyhole appearance. Okay, keyhole appearance of glottis in phonoasthenia will be seen because of the weakness of thyroarytenoid and medial fibers of vocalis muscle. Now let's see what is functional aphonia. The functional aphonia here, it is in emotionally labile individuals. Stress or anxiety will induce functional aphonia, means they cannot talk, they cannot produce sound, but other anatomy is preserved there. There is sudden emotional shock. Okay, due to sudden emotional shock, there is no neurological deficit. Okay, and the diagnosis is cough test, means we'll ask them to cough. Okay, they are saying that they cannot speak. Okay, so we'll ask them to cough. If they can cough, we'll get to know that for cough reflex, their vocal cords are coming in the midline, so why cannot they come for talking or something like that. Okay, so diagnosis is cough test. Vocal cord adducts. Okay, so in cough vocal cord adducts, so they can adduct while talking also. Okay, So the patient is psychologically refraining it. Okay, so we have to refer to the psychologist. So all these things what I'm telling now, this is because of prep ladder faculty, ENT faculty, Vaishnavi ma'am. Okay, so whatever this sounds, this breathy voice or this strangulating voice, or here I'm saying this cough test, if the person can cough but how cannot he speak, so all these things is because of Vaishnavi ma'am. So I'm so much thankful to her. So thank you so much. This was about the pathologies of voice. Thank you so much.